joined colleagues, there were 5 of us or 6 of us on the House floor, asking Republicans to give us a vote on common sense gun prevention legislation. Today, my colleagues and many Americans are demanding action as part of a national day of action to prevent gun violence. We know that gun violence is one of the most serious public health issues we have. In Sacramento County itself, we lost 62 lives last year. And throughout the country, there are over 30,000 gun deaths. Both Democrats and Republicans have demanded common sense legislation to address gun violence in America. I've heard from many in Sacramento over the last week who support common sense gun violence prevention policies. You know, like many Americans, we have dealt with the direct results of gun violence in our communities. Just last year, J.J. Clavo, a high school senior with a bright future ahead of him, and just recently, Destin Garrett, who was supposed to graduate from Sac High. Since our sit-in last week, 177 people have died in gun violence. Now, earlier today, I spoke to constituents and advocates, and that is why I felt it was important on this gun violence prevention virtual roundtable as part of a National Day of Action. We want to provide some answers about the devastating effect of gun violence on people in Sacramento and to continue the momentum towards action. And I'm joined here today by 3 remarkable health professionals from UC Davis. Dr. Garen Wintemute is the Director of University Violence Prevention Research Programs. Dr. Magdalena Cerda is also part of the Violence Prevention Research Program and serves as its Associate Director. And Dr. David Schatz is trauma surgeon and professor at UC Davis. Welcome to all 3 of you.
Thank you.
Thank you. Now let's start by defining the problem. Which populations are most affected by gun violence in California and across the country? And let's start with you, Dr. Wintemute.
Sure. There's really no population that's not affected. It's one of the things that is very important as we take this problem on. We tend to think of violence as first as a crime problem involving homicide, and that's a problem that most often affects young men. But nationally, 2/3 of gun deaths are suicides. Suicide outnumbers homicide 2 to 1. And suicide is most common among older men. Intimate partner violence is most common, obviously, among women. Unintentional shootings disproportionately affect children and young adults. There's really no part of the population that does not have a direct stake in firearm violence.
Okay, and how does the United States compare to other countries when it comes to mortality due to guns? And Dr. Cerda, can you chime in on that?
Yes, so according to a comparison of homicide rates and gun violence rates in the United States to other developed countries, that is high to middle income countries, the United States exceeds them substantially. For example, compared to Finland, one of the countries that has the second largest rate of gun violence deaths, the United States exceeds it by more than 2 times. And there seems to be a very strong link between the number of guns per capita in the home and the rate of gun violence. So for example, a study that compared 27 developed countries found that the United States had one of the highest rates of gun ownership and also one of the highest rates of gun violence, compared to, for example, Japan, one of the lowest rates of gun ownership per capita, one of the lowest rates of deaths from gun violence.
I see. Now, your research focuses on gun violence as a public health problem. Can you talk about the social and financial costs of gun violence?
Yes, it's been estimated that, for example, in 2012, it was estimated that we spent $229 billion as an annual cost involved in gun violence. And we can think of the cost of gun violence not only due to physical injuries and disabilities that result from from specific injuries, but we can also think about costs related to mental illness, for example, post-traumatic stress disorder following an event. We can also think about costs in terms of job loss, unemployment, costs to families in terms of income losses. And we can also think about costs to the healthcare system. So the repercussions of gun violence go way beyond just the very important physical injury that people suffer to the impact that that injury has on families, on communities, and on whole societies.
Okay, well, Dr. Wintermuth, you mentioned that your research has found suicide, death by guns, is now far more common than homicide, and its rate is increasing while the homicide rate is decreasing. Can you talk more about the dangers of easy access to guns for both homicide and suicide?
Yes. We have traditionally tended to think of them as very different, but risk factors for homicide and suicide are often in common. For example, alcohol abuse is a risk factor for both homicide and suicide. Being male is a risk factor for both homicide and suicide. Age is a risk factor, but it works differently. Young age for homicide, old age for suicide.
Okay, well, how has the federal policy and or lack thereof, such as effect on CDC research of gun violence, limited your ability to do the research we need? And Dr. Wintermuth and also Dr. Serta, if you comment on that.
Sure. America has a proud tradition of responding to crises by mobilizing. The best, most relevant example is our response to the death and injury caused from motor vehicle traffic crashes. We mobilized to stop that epidemic 50 years ago successfully, such that there are now today essentially as many deaths from firearm violence as there are from motor vehicle crashes. We started such a mobilization 20-some years ago for firearm violence and then deliberately choked it off, such that today there really is no substantial program of research on firearm violence, at least at the federal level. And as a researcher and as a clinician, I'm left with the question, how many thousands of people are dead today who would have been alive if we had continued that research, if we had answered tough questions and implemented solutions based on those answers, when today we don't have the answers to those questions and people still are still dying.
So you're basically saying the lack of data is really hindering you here. Dr. Serta, you want to comment on that also?
Yes, and to follow up, particularly with the case of motor vehicle fatalities, we know that motor vehicle fatalities have decreased about 95% since the 1950s, when we started investing in research on the potential causes of motor vehicle fatalities, and we started investing in regulating the product, that is cars, and regulating drivers. So imagine if we were able to use data and use policies that have been informed by data to reduce motor vehicle fatalities by 95%. How much could we do with data to reduce the magnitude of the problem from gun violence fatality?
Absolutely, and I'm thinking that, we're talking, Dr. Serta and Dr. Wintermuth about trying to prevent gun violence. And Dr. Schatz, you're at the other end. You're working in the UC Davis Trauma Center. You treat victims of gun violence routinely. Can you describe a typical emergency room scene on a weekend night? And I'm assuming that weekend nights are the times when you get the most victims.
Interesting enough, when I was in Miami, we did look at that data, and there was more weekdays that tend to be busier than the weekends. Yeah. But the reality is that the gunshot, any kind of violent crime happens 7 days a week and almost 24 hours a day. So any victim of any trauma, whether it's a gunshot or otherwise, is brought into the emergency department. They are a team of nurses and doctors descend on the patient. All the clothes are cut off, IVs and tubes are put in, and the workup has begun. If the patient is stable enough, they get CT scans, etc. Otherwise, it was off the operating room where that appropriate cavity is opened, and then we try to fix the injury.
Well, does it matter what kind of gun a victim is shot with?
No, everybody talks about the high velocity versus low velocity, the hollow point versus the variety of caliber weapons or bullets. The reality is just what organ it hits. So if it's a 22, a small caliber weapon, and hits the heart, you're going to die. If it's a large caliber weapon that hits the extremity and hits a muscle, it's probably not going to be that big a deal. It's going to be a lot of pain, and it might be a lot of disability from future muscle or bone fractures, etc. But it's really the organ that it hits.
Okay, we're just thinking here about the number of people affected by gun violence across the country and in California also, where it seems that guns are used as a first reaction to any kind of any kind of argument or whatever. And I've seen this increase, and we're trying to figure out a way, and I think we're trying to figure out through prevention and more data, which hopefully that we can get. In California, you have more data that's available to you than federal data.
Yes, we do have. And the program here at UC Davis has been working with those data for almost 30 years now. Much of the work that we do simply cannot be done anywhere else for precisely the reason that you mentioned. California has uniquely rich data on violence of all types, particularly firearm violence, and on commerce in firearms, and we are able, excuse me, to use those data to answer important questions that feed into interventions. We also are very fortunate to have a state legislature that sets a very high value on scientific evidence as a basis for policymaking, that relies on that evidence as they make policy, come back to the scientists and ask for an assessment of whether the policy worked or not. California has really become democracy's leading laboratory on this issue.
Oh, I see.
I do want to say that, excuse me,
Yes.
that though we have that great data in California, we have severely lacking data when it comes to the EMS, the pre-hospital side, and linking to the trauma side, and then the final outcome. So basically the time of injury at the time of discharge of the patient. And a lot of that is funding. And so lack of the proper funding to get the personnel to be able to link these data systems and the computer systems to make them work. So we can actually then have an idea of this person was shot this day and what was the outcome? Was the hospitalization short, long, on and on? So yes, we have numbers for the actual incidence of a gunshot, but we really don't have the information for what happens to those people as a conglomerate, or as to be able to study those patients individually, other than what I do at my center and everybody else knows at their respective centers.
I wanted to ask you this, Dr. Schatz. Is there a difference between obviously there is, but in your experience between mass shootings rather than the individual type that we might see more in Sacramento?
Well, like in any mass casualty event, it's disastrous in the military style, where the triage goes for the benefit of the most and not the only. So if a single patient gunshot wound is severely injured, we'll expend all resources to keep that patient alive. If we now have 10 people who are injured, that person who we might have been able to save with a lot of resources will now be essentially put in a corner with the effort to save the other 9. So.
Dr. Wintemute, I know you have been doing an awful lot in the area of gun violence prevention. What do you think that Congress can do? I mean, we know we would love to have more data. I mean, I think it's really important for a public health aspect of it. But what else do you think Congress should be doing?
And I'll give you a short list. There could be a long list, but I'll stick with the short one. So funding for research, I think, is really important. It's as if we had decided at the federal level not to provide not to provide funding for research on cancer or research on heart disease. We know that research matters. It helps. Firearm violence is this exception to that general principle. With regard to interventions that might prevent future gun violence, the one I would put at the top is comprehensive background checks. It's been discussed extensively, don't need to discuss it here. I've generated some of the evidence, and I'm aware of much of the evidence on the effectiveness of those programs. The evidence is not as voluminous as we would like, but there is a fair bit of it, and the results are consistent. Background checks work. It would also work, I believe, based on work we did here in California, would be effective to expand the criteria for denial of firearm purchase to include people who've been convicted of violent misdemeanors. California undertook that expansion in the 1990s, and our work showed that it reduced risk of future violent crime by the people who were affected by 25 to 30%, which is a big effect.
I'm thinking about the fact that if we treat this as we like to as a public health issue and get the data we need and the research, we would make great progress in order to find the causes of gun violence. I'm also looking at, you looked at background checks. I truly believe that too, and there's a certain loophole there as far as background checks in which you can bypass them by going to a gun show or going through the internet. And I believe that if we can have the bill passed, it would be helpful in many, many ways. And also we have a no-fly, no-buy legislation. If you're on a terrorist list, you shouldn't be able to board a plane or buy a gun. And those are the very simple bipartisan things. I say simple, it seems to me that we should be able to do that, and yet we have not been able to do it to this point. And I'm looking at what you do as researchers and also emergency room physicians, because you have a voice in this here. You understand what can happen if, in fact, we lessen the incidence of gun violence. And so I look to you. Are there any other aspects of this that you think that the American people should know about? Dr. Serta?
Yes, I would say that the response to gun violence, part of the response to gun violence is policies related to the regulations of manufacture, purchase, and possession of guns. Another part of the answer to gun violence is figuring out community level responses to violence, gun violence, and within it, the broader problems of violence. And we know that in addition to gun-related policies, there are also community level policies that could be a promising way to prevent the problem of gun violence. So in particular, some studies have found that implementation of focused deterrence programs, as for example, the Operation Ceasefire in Boston, which has since been replicated in multiple cities across the country, where they targeted the less than 1% of people in Boston who are responsible for more than 60% of the homicides, and tried to work with community members and police to communicate the fact that violent acts would not be tolerated, and violent acts, particularly among gang members, if they did happen, were met with a very focused law enforcement response. That kind of operation seems to have had has led to the significant decrease in gun-related homicides in multiple cities across the country. We've also seen that more community-based efforts, such as the Cure Violence programs that started in Chicago and that have been since replicated in several cities across the country, which focus more on community members working together to communicate change social norms about how acceptable using violence to solve conflict is, and where community members work to interrupt violent events before they happen and to mentor high-risk youth to deter them from a trajectory of violence. Those kinds of programs have shown some promising effects in terms of reducing the problem of gun violence. So I would say that in addition to policy responses, we should also think about community level responses where multiple sectors, including researchers, law enforcement, public health, and community members work together to address the problem of gun violence.
Dr. Wintemute, you have a comment on that also?
I certainly agree with everything that Magda just said. I'll mention something specific, a new mechanism that's available just here in California. That's the gun violence restraining order, which is modeled on our domestic violence restraining order process. It allows family members or law enforcement to go to a judge, and in a very high-risk situation where firearms are involved, to say, Your Honor, we're aware of a person who has guns, is not prohibited from having guns, but for one of a number of reasons, we're very concerned that that person constitutes an imminent risk of harm to themselves or to others. And if the case is well made, the judge, as in domestic violence, has the authority to issue a restraining order, which would have the effect of removing the guns from that situation, excuse me, for a brief period of time. There are several mass shootings in our collective recent history that might have been prevented had that mechanism been available or used. It has just now taken effect. We're hoping to evaluate it. But in the meantime, I think the pitch is, in this case as in others, if you see something, say something. We have learned from several mass shootings that people in the immediate social network of the shooter were aware for weeks that our friend, our family member is falling off a cliff. And this gun violence restraining order mechanism gives those people the opportunity to call for help when that happens.
Right, absolutely. Dr. Schatz, do you have a comment? I mean, you've seen the part of it at the back end of it where you see the violence already done on a person. So do you have a comment on all of this?
Unfortunately, we see way too many people who this is not their first time being shot. And the recidivism rate is too high, not to mention the innocent victim rate. And I think there's two things. First, most people don't think they'll ever be a victim of injury or trauma, much less a gunshot wound. But how many injuries do we hear beside the mass shootings of the child hit by a stray bullet, the person, again, the innocent victims hit by bullets. So that certainly is an issue. Now, we also have a program in place for a long time now with known as a brief intervention. That is for alcohol-related injuries. And it's been shown that if you speak to patients acutely after their car accidents, for instance, while they're hospitalized, they'll have a much better reaction to speaking to them about stopping the alcohol intake, or at least doing it appropriately, as opposed to doing it some future time. We have no such intervention for violent crime and certainly gunshot injuries. And a lot of that because we haven't got the data. We go back to our data collection comments at the very beginning.
Right. Well, that's really true too. I hadn't thought about that aspect of it. But listen, I am really happy to have this conversation because I believe that we have to look at gun violence in a very broad sense too. It is a public health issue and we need to get the data. We understand that. But we also understand too that even though your research and insight on this issue is invaluable, we have to address the problem of guns in a sense of the wrong people having guns. So right now, in the wake of the deadliest mass shooting in the history of our nation, and with the continued violence on the streets, and we see this in a sense, many times there are shootings on a weekend, there might be 3 or 4. They don't really garner the news as mass shooting would, and yet collectively it impacts so many families and involves the community, and many times the most vulnerable amongst them, which are the children. So what we would like to do, and you also, is to speak up. Americans need to speak up and really demand action from Congress, because we really believe that we need to get the guns away from the people who shouldn't have guns. So in essence, background checks are so important because there are loopholes in that they can go on the internet and also to gun shows. People shouldn't be flying if they're on a terrorist watch list. Those are fundamental things that Americans can actually really agree to. So we really feel that it's important to bring those up, and also the fact that we need more data. We should not be afraid to look at these incidents as a public health issue. I've always believed that it's better to prevent bad things from happening. And certainly In order to do that, we have to have the data to address what is happening and understand and do the research. So we are making our collective voices heard, and we like to have everyone stand up and speak to their members of Congress and urge those to, everybody to join with us via YouTube to demand a vote on gun violence in Congress. So I want to thank you all, Dr. Winter-Newton, Dr. Schatz, and Dr. Serta for joining me here today. And I'm hoping that we can do more of these virtual roundtables to address some of the problems and issues that we brought up today as far as data and some of the things we can do to follow up. And so we can address this problem at the community level as well as at the national level. So thank you so much. And thank you very much for all of you for listening to our experts. I look forward to continuing to work with you and with my constituents to address gun violence in our country. Thank you.
Thank you.